Seja bem-vindo às aulas de fator humano, Human Factors, bem simples, né? A tradução. Essa foi a matéria que, assim, na Austrália, essa é uma matéria de governo. Assim como na ANAC aqui, né? 5 matérias, lá são 7. E uma delas é fatores humanos. Eu achei maravilhosa essa matéria. Foi uma matéria que não foi assim, um estudo, ai meu Deus, tenho que estudar, pesado, ficou triste. Na verdade foi uma diversão, foi tipo ler uma revista muito gostosa. Foi a matéria que eu mais me apaixonei em fazer o exame, adorei, fiquei até triste quando tive que fazer, não tive mais que estudar essa matéria. Adorava, não parecia que eu estava estudando. Ou seja, foi uma grande paixão. Eu adoro as ilusões, como é importante o fator humano, a gente não dá valor, né, ao fator humano com o CRM, né, quantos acidentes aconteceram, quantas pessoas não perderam a vida por fator humano. O ser humano tem um comportamento equivocado que liderou uma aeronave perfeitamente, funcionando sem problema nenhum, num ambiente sem problemas meteorológicos, a aeronave perdeu o controle ou então entrar numa situação que não conseguiu se reverter. Ou seja, o fator humano ele é muito importante. Vamos lá. English mode. Flying at altitude. Flying at altitude. The human body is designed to function in the lower level of the atmosphere where the air is fairly dense. Lower external pressure causes gases inside body cavities to expand. Lower oxygen pressure causes hypoxia. Dissolved gas come out of solution, also due to decreased external pressure. Human life depends on oxygen, pretty basic. The amount of oxygen passing through the lung membrane depends on the partial pressure of oxygen at the alveolar surface. At 9,000 feet, the partial pressure of oxygen in the air is about half that at sea level. Hypoxia is a condition in which oxygen concentration in the tissues is less than normal. Total absence of oxygen is called anoxia. Hypoxia is a lack of oxygen, no presence of oxygen. And this may be caused by several factors. A lack of oxygen in the air called hypoxia. A partial pressure of oxygen that is too low. An inability of the blood to carry oxygen called anemic hypoxia due to a medical condition, anemia, or carbon monoxide poisoning in the blood. Let's say a faulty engine exhaust system or cigarette smoking. Hypoxia is subtle and it sneaks up on you like the effect of an extra glass of wine. You just get a little bit dizzy. Unconsciousness may occur before many of the symptoms of hypoxia appear. The brain is affected quite early, so a false sense of security and well-being may be present. You feel like Captain America. Physical movements, clumsiness, headache, deterioration of vision, high pulse rate, blue lips and fingernails, cyanosis, and tingling of the skin may all follow. Susceptibility to hypoxia. A person who smokes has less oxygen circulating. The onset of symptoms of hypoxia will occur at a lower altitude in that person. However, a smoker is acclimatized to being hypoxic and may be more tolerant. Funny, huh? Blood donation makes you prone to hypoxia. Pilots should avoid donating blood, unfortunately. Alright, but if you do donate, you gotta stay at least 24 hours away from flying. It's legally speaking. Alright. So the thing is, if you smoke, you tend to go towards hypoxia faster. But the symptoms of hypoxia, the smoker already is used to. It's funny, huh? Time of useful consciousness. The cells of the brain are particularly sensitive to a lack of oxygen, even for brief periods. Total cessation of the oxygen supply to the brain results in unconsciousness within 6 to 8 seconds, called TUC, time of useful consciousness, or EPT, effective performance time. Irreversibly, damage ensues if the oxygen is not restored within 4 minutes. Ensues. Hypoxia, time of useful consciousness. Yes, like as high as you are, as higher you go, as higher you're gonna lose your consciousness. Barotrauma. Another effect of increasing cabin altitude is that gases trapped in parts of your body, such as in the stomach, intestines, sinuses, middle ear, of a decaying tooth, we will want to expand as external pressure decreases. They may be trapped and possibly cause pain, known as barotrauma. Barotrauma of the ears. The cavity behind the eardrums has a small tube, the Eustachian tube, that is open through the nose and allows air pressure on the inside to be balanced with outside air pressure. If we have a cold or sinusitis, this can become restricted or even totally blocked. You could cause pain. This pressure difference can cause pain. The way out is to equalize by opening the Eustachian tube. This is achieved by swallowing, chewing, or by blowing with the mouth and nose held closed. There is a movement called Valsalva maneuver, but it's just too much stuff. I gotta reduce, so the class is gonna just become too big. Hyperventilation occurs when the body overbreathes due to some psychological distress, such as a fear or anxiety, gasping for air, gasping for breath. Hyperventilation flushes the carbon dioxide out of the blood and disturbs its chemical balance, producing symptoms of lightheadedness, numbness, and tingling in the lips and fingertips and toes. It might lead you to unconsciousness, the last stage, but you're gonna feel a lot of other things on the meanwhile. The treatment directly remedy for hyperventilation is to breathe into in and out of a paper bag to restore the carbon dioxide level in the blood. It may be difficult to establish whether the problem is hyperventilation or hypoxia. They kind of look alike. That's the deal. you're gonna have to judge by the person. If the person's like nervous, like a passenger, probably it's hyperventilation. Carbon monoxide poisoning. Carbon monoxide is produced during combustion. It is a colorless, odorless, tasteless, and poisonous gas for which hemoglobin in the blood has an enormous affinity. Carbon monoxide is insidious and can be ultimately fatal. Recovery even on pure oxygen may take several hours. Engine smells in the cabin are a warning. A warning sign that the carbon monoxide may be present. Many operators place carbon monoxide detectors in the cockpit. More advanced aircrafts, usually pressurized ones. Dehydration, sorry, is the only associated with hot days, and it's not only associated with hot days and intense sporting activities when we don't drink enough fluids. As we climb, decreased density and temperature means less water is available in the atmosphere. On larger craft, the pressurization and air conditioning tend to reduce the moisture content in these systems to keep the cabin environment comfortable. Always carry drinking water, especially in summer. Dehydration can quickly affect the brain's ability to function normally. Yes, sir. Can become impaired. Alright, guys, that's the end of class. É um prazer falar dessa matéria, eu adoro. Acho que eu deveria ser médico, né? É um caso da medicina ligada à aviação, eu acho muito interessante. São alertas muito importantes que a gente não leva a sério. Muitas vezes acha que os fatores humanos é uma coisa desimportante, mas é muito importante para a aviação. Tá? Até o próximo vídeo. Foi um prazer. Tchau, tchau.